Hello viewers, welcome to the Medical Board Exams Experience with Dr. Kwafu. Medical Board Exams is an exams written by most medical graduates to enable them obtain the license to practice as legal health professionals. Preparing for these exams can be very challenging, especially if you do not have pre-informed knowledge about how to study or prepare for these exams. It is for this reason that I have created this channel to invite doctors who have successfully passed their medical board exams to share their preparation experience with us and with those who are preparing to write theirs. You will have doctors from different countries, and so we will talk about the medical board exams of different countries. Maybe the country we'll talk about today may not be the country of your choice, but just subscribe to this channel and hopefully our next country of discussion may be the country of your choice. Today we have with us Dr.Horner Brew, an international medical graduate of Ivano-Frankivsk National Medical University in Ukraine, who has successfully passed his Ghana Medical and Dental Council Board exams and is currently practicing as a doctor in one of the most prestigious hospitals in the capital city of Ghana. Let us join Dr. Brew in our discussion room. Thank you. Welcome, Dr. Horner Brew, to the Medical Board Exam Experience with Dr. Kwafu.
Thank you very much, Dr. Kwafu. It's good to see you again.
Good to see you too. It's been a long time.
Yeah.
Dr. Brew, for the sake of my viewers, can you tell us what the GMDC exam is and who is qualified to take these exams?
Okay, first of all, let me extend my greetings to all your viewers all around the world. Back to your question. GMDC simply means Ghana Medical and Dental Council. See, this is the regulatory body of the medical profession in Ghana. They usually organize year by year examinations for foreign trained graduates, medical graduates, in order to ascertain their readiness to serve the country or their preparedness to practice medicine in Ghana. So essentially, one that is qualified is a foreign medical graduate with genuine certificate who is willing to practice in Ghana. Yeah.
Okay. So, after you graduated from your medical school, how long did it take you to prepare for these exams?
Essentially, it took me about 6 months to prepare for the exams. Essentially 6 months, yeah. Because I graduated in around July 2018, and then I started my preparation in August. So I wrote in February.
Oh, okay. So the GMDC exams, for those who are not familiar with Ghana system, is it taken in only one language or in how many languages?
Okay, to the best of my knowledge, it's taken in one language, which is English medium. That's our official language here. So that's what it's taken in English, yes.
Oh, okay. So, but how long does it take to register for the exams if you start the process?
Well, they give us a time frame once you come, depending on the batch which you'd want to join. During my time, there was February batch and then October batch. So you can either decide to write in February, you can decide to write in October. So if you're intending to write in February, then the registration period is from September till latest first week of January. Else you'll be shifted ahead because they need to control the numbers. Do you understand? Yeah. So usually it's a time frame from September to January. And what involves is that once you submit your application, they contact your school to verify your identity and to verify your proof of graduation and good standing. Okay. so that they can finally then register you for the exam. So once they've gone through all that process, they will now give you a call and tell you that you are now eligible to write the GMDC exam.
Oh, okay, okay. So they take it like 2 times or 3 times a year.
Okay, so before it was twice in a year, February and then October. But in recent times, because of the increased number of foreign medical graduates, it's been moved to 3 times. Now it's February, June, and then October.
Oh, okay, okay. So the exams is in how many sections?
Well, now it's in 5 sessions. Before it was in 6. So there are 5 disciplines now. We have the internal medicine, we have the surgery, we have the pediatrics, we have the obstetrics and gynecology, and then we have the community health or community medicine. Before there was family medicine in addition, but they have omitted that one. So now we are left with these 5.
Oh, okay, okay, okay. And on a typical exam day, how long does the how long does the exams last? If like the duration of the exam on a typical exam day?
Okay, on a typical exam day, I wrote the time I wrote it was 6 subjects. So the MCQs was comprising of 20 questions per each discipline. So that is 20 by the 6, making 120 MCQs. And the duration for that MCQs was 2 hours. It was 2 hours. While the theory or the written parts was a total of 5 questions per each discipline. So making 30 questions. And we were writing that in a duration of 3 hours.
Okay. Do you write both sessions on the same day?
Yeah, you write both sessions on the same day. The MCQs, once you are done, you go for some 30-45 minutes break. Then you come back for the theory. Then you are now given a schedule for when you would have your oral part, or what we call popularly here viva.
Oh, okay. So tell me more about the oral part. Like how is it on a typical
Okay.
oral test day?
Okay, so on the typical oral first day, now we have 5 stations. Okay, so and it's 10 minutes per station. 10 minutes per station, and each station has 2 examiners. Okay, and any of the examiners can throw at you any question at all, and they expect you to answer. So the 5 stations are divided according to the disciplines. So there is internal medicine station, there is surgery station, there is pediatrics station, there is obstetrics and gynecology station, and then there is community health station. So 10 minutes for each. So once you are done with one station, a bell is rung, then you move on to the next station. So in total, the duration for that is about 50 minutes.
Oh, okay, okay, okay. Are you giving the results on the same day, or how do you get the results?
Oh, not at all. You don't get the results on the same day. Your results are processed within a number of weeks. Okay, that is hugely dependent on the council, on the conduct of the examination. You know, they have to go through a lot, sort things out, and also depend on how fast they would finish is when you get the results. And during my time when I wrote, we got the results as fast as within 2 weeks. We got our results.
Oh, okay, okay.
Yeah.
Like during your preparation, did you attend any special classes or lectures to prepare for this exam?
Well, yes, I did in the later part. Like I think the later part, when it was about 2 months, like about around 6 to 7 weeks to my exam. Yes, I turned to a tutorial class, so at least sharpen my skills and then be more competitive because there are other people around who are also writing the exam based on what I had already learned the 4 months prior. Because the 4 months prior, I was doing other things. I was doing a clinical rotation in order to familiarize myself with the clinical system in Ghana. So the last 7 weeks, I now attended a tutorial class.
Oh, okay, okay. So are there specific books that you will recommend for someone that is preparing to write these exams?
Oh, yes, definitely. I mean, depending on the subject which you are preparing for surgery, I would strongly recommend Baja. Yes, for internal medicine, I would strongly recommend the Oxford Clinical Handbook. Okay, for community health, pedics, and the others, I was largely that is, this is in my case. I don't know for others. I was largely depending on the lectures conducted here in the Ghana medical schools. Okay, yeah, so that I know because it is their examiners that are taking our exam. So I wanted to know the dynamics of their lectures. So largely I was dependent on their lectures to prepare for the exam. Yeah.
Oh, okay. So, is there any question bank or practice assessment questions that you did to assess yourself before the test day?
Well, yes. So there are assessment questions that are released by the council and is there, okay, that everyone has access to. We call them MDC revisions. Right? Those are practice questions. In order for you to familiarize yourself with the kind of questions you are expected to answer. Okay. But that not
Okay.
saying that they are going to repeat those questions. It's just to help you understand and know the kind of questions they'll be asking you. But other
Okay.
than that,
So,
there is nothing like a base or bank of questions where you read to hoping that there will be repetition or anything. Yeah.
oh, okay. But the questions you saw before the main exams, did they have a little similarity or was it the same
Oh,
format?
yes, yes. They had some similarities. Yeah. I mean, the similarity was very, very significant. I mean, some of the questions were, I mean, the clinical diagnosis was verbatim, though the clinical scenario will be changed a bit.
Okay. Okay. So during your preparation, when you got to the peak, how many hours were you studying a day? Like, how was your
Okay,
schedule like?
so my schedule was like usually I would start in the morning, okay, by 8 o'clock. I'll go to the hospital, go and clerk some patients, see my seniors, present to them, and then put myself on the spot, all right, for them to ask me questions. That is from the morning. So from about 8 to 11, that's just what I'll be doing. I'll just be clerking patients and then applying myself with the clinical knowledge. So once I'm done, then I'll just, from let's say, I'll take a little break from 2, then I'll study till say 4. That's about 2 hours. And then I'll go for another break, have enough rest, have something to eat. Then I'll come back and continue from 6 till 10. So approximately, I would say I was practically learning the whole day because the only time I would take a break is when I'm just going to have something to eat or relax a bit, which is just for about a maximum of 2 hours, and then come back to my books. Yeah.
Okay. So you initially mentioned that the exam covers about six sections.
Yeah, but now it's
Which
fine.
which which section do you think dominates most in the exam?
Okay, see, the exam, to be very honest, all the sessions actually dominate. None is below the other because they all carry the same marks, they all carry the same strength. So one cannot say that I'm preparing so hard for surgery and not prepare so hard for community health. Or one cannot say
Okay.
I'm preparing so hard for pedics and not prepare so hard for ONG. It will go against you at the end of the day when they are striking the average. Yeah.
Okay. So if unfortunately someone fails the exam, is the person allowed to take it immediately or he or she has to go through a certain process before she can retake the exam? And how
Well,
many
that
times
lad.
can
Okay, okay, I understand your question. So, well, that largely depends on the council. Once you fail the exam, the council is the one that determines whether you'll be eligible for the next one or you'd have to prepare more to come. So, usually, when persons fail, they go to discuss with the council, and then the council will now give them an appropriate date depending on the assessment of you. Okay, so a person may fail, go to the council, and would be eligible for the next sitting. But another may fail, go to the council, and only be eligible for the next 2 sittings. Okay, that is per the discretion of the council.
Oh, okay. So if you are to prepare this whole exam again, what will you do different? Will you repeat the same thing you did, or you do something different?
To be very honest, I'll do the same thing. I think if I do the same thing 100 times, I'll pass 100 times. I'll do the same
Oh,
thing.
okay. So you will recommend someone to attend the lectures that you did?
I recommend that a person that is essentially okay. Everyone has what works for them. Okay, so for me, what was working for me was the fact that I needed to acclimatize myself with the system here in Ghana by doing a clinical rotation, clinical practice for 4 months, 4 straight months. So all I was doing was just going to the hospital, clerk patients, present to my seniors, apply myself. Okay. Some will just come to the hospital and they'll just be walking around doing nothing, wasting their time. But you come, you clerk patients, you apply yourself. Let yourself be, they call it washing, something like that. I mean, you wash them and then, they expose your flaws. Okay. That it also helps build your confidence. So I did that straight for 4 months, very intensive one. So when I come, then I'll come and learn according to the topics that I'm preparing for towards the exam. So when it was left with the last 2 months, then I now said, okay, fine, I've had enough of clinical experience. Let me now go into the classroom to go and see other colleagues or compete with other colleagues that are preparing for the exam. Because there you see real competition. There are a lot of people that are also going to write the exam, and most of them come to the classes. So I went there, applied myself there too, and then hopefully I made it.
Okay. So per your experience in how medical education is outside, in medical education is in countries outside Ghana, will you recommend that a fresh graduate has to go through like the 4 months clinical experience you had before writing the exams? Or if the person is good, he can just register for the exams?
Well, thank you for that question. It's a very important question. Well, it's very much individualistic. You look at yourself and you look at your strength. I didn't want to go into the examination half baked. I wanted to be fully baked and fully hot for the exams and for the examiners. Okay. So if you come and you assess your strength and you believe that you can use 3 months to be fully baked, I encourage you to go for it. Okay, you don't have to waste so much time. But if you assess yourself and you realize that you really have to put in a lot of work, then go for the other one. It's entirely up to the candidate and how they see themselves.
Okay. So for someone who is still a medical student, what time do you think is appropriate to start preparing for such a board exams?
To be very honest with you, right from first year. To be very honest with you, it's right from first year. Most people travel outside and they are not even aware that when they come back to their home countries, there is a board exam to write. And all the questions that you are seeing in the exam, the examiners will ask you in the theory, in the MCQs, they are all based on your 6 years medical school experience. So, really and truly, those that find it easy to pass the exam are persons that were serious in school right from first year. Okay, so everything will just come so easy for them. But then if you started preparing late, like let's say after your after your 6th year or after your 5th year, you realize that you would have so much to cover. Okay, other things that you might as well should have known if you were serious back in say 3rd year or 2nd year. Okay, yeah. But sometimes to understand some of the clinical conditions, you should understand the basics very well. Your anatomy, your physiology should be very, very good. You can't talk about pathophysiology if you don't know physiology. How do you talk about interventions in surgery if you don't know anatomy? So yeah.
Oh, okay. So from your experience, you've gone through the process. How long does it take after passing the exam? How long does it take for one to get posted to start his or her house job?
Okay, well, so approximately it takes about 5 months. So the schedule that we have here takes about 5 months, yes. So, for example, if you write in February, the time you'll be posted is around September. By September, you'll be on board. And if you write in October, by the time you posted, it will be somewhere around May.
Oh, okay. So I want to also ask for my viewers the financial aspect of this whole exams process. How much does it cost? From
Well,
the registration, everything, and
from the
even the classes you
preparation.
attended.
Okay, well, so for now, I really don't know how much it costs now, but my time, the classes that I was attending, the person was charging 200 cedis per month. Okay. And
Okay.
I went for 2 months, so practically I paid like 400 cedis. And
Okay.
for the hospital rotation, I mean, you don't need to pay any money for any hospital rotation, unless, of course, hospitals change their policies now. And then for the exam itself, for the registration, my time we paid $700. I mean, equivalent in cedis. Okay, for the exam.
Okay.
Yeah, but
Okay.
now I hear it's around $800. Yeah.
Okay. So when one gets posted to start the house job, is the person paid and how much? What about accommodation?
Well, okay, so once you start your house job, depending on the facility that you, I mean, your pay as in your salary is constant. But that one coming from controller, that is constant. But for additives, like from the facility, it depends on the hospital you are going to. Okay, some hospitals provide accommodation, some don't. Some hospitals provide certain amount of allowance, others provide very little amount of allowance. Okay, so it largely depends on the facility you are going to. If you are going to a facility like, say, for example, I'm here in Kolebu, they have packages for feeding allowance and then packages for accommodation allowance. Okay. And then if you are going somewhere
So
like Cape Coast,
how much does it like the monthly salary of a house job person?
oh, it's actually, I mean, now it's about 4,200. Around four. That's for first year. For first year, it's about 4,200, and then for second year, it's about 4,005
Oh,
Ghana
okay.
cedis. Yeah.
Oh, okay. So is there any final words you have for anyone preparing for these exams?
Oh, what I'll say to them is that the exam is doable. It's very, very doable. No one should be afraid of the exam. It's standard exam. In fact, in my opinion, it's not so standard, not so standard, but for the sake of fairness, let me say it's standard because if you should compare the exams, the intensity of the exam, okay, for the foreign medical graduates and the intensity of the exam for the locally trained doctors, you can see that the intensity here is far more. If they were to apply those same measures to the foreign medical graduates, I'm sure hell will break loose. The exams will finish and you will just have very few people passing. Okay, so
Okay.
the exam is very, very doable. All you just have to do is just be ready and then prepare, regardless of whether you are an intelligent student, whether you are an average student, or whether you are a bad student. It doesn't matter. Examination favors no one. It only favors the one that is prepared for it. So just prepare for it and then mentor your seniors, and I'm sure you are very fine. The last thing I would also say is that I would encourage everyone to really subscribe to your channel. To be very honest, I mean, if most people had access to information sharing like this, I'm sure things would have been much, much easier for them. I mean, the awareness would have been there, and then they would know that they would have to sit up.
All right. Thank you, Dr. Brew, for joining us today. We
Yeah,
hope to
you're
have you
welcome.
on this platform again very soon.